Good day, everyone, my dear colleagues. Welcome to today's lesson. My name is Afet Ismailova. I work at the Ganja Medical College more 26 years. I teach our college three departments. Laboratory diagnosis department, I teach biochemistry. Nursing department, I teach pharmacology. And pharmaceutical department, I teach pharmaceutical chemistry. Today, I want to inform of science pharmacology. Pharmacology basic concepts, mechanism of action drugs. Pharmacology is the science of drugs. Their origin, composition, effects, properties, and mechanism action drugs on the living organism. It also study are absorbed, distributed, metabolized, and extracted of the living organism. The term pharmacology comes from the Greek word pharmakos, meaning drugs or medicine, and logos, meaning science or studies. Pharmacology is divided into several branches: general pharmacology, special pharmacology, clinical pharmacology, toxicology, pharmacodynamic, pharmacokinetics, and chemotherapy. Pharmacology, the main goals of pharmacology are to study drugs, how affect on the living organism, to determine therapeutic and toxic doses, to understand mechanism of action drugs, to find new and more effects drugs, to ensure safe and of medicine in practice. Pharmacology plays a central role in medicine because providers of the drug in the prevention, diagnosis, and treatment of diseases. Pharmacology connects basic science like chemistry, physiology, and biochemistry with clinical practice. A good understanding of pharmacology is essential for healthcare professionals to ensure safe and effective patient care. Before understanding of pharmacology, it is necessary to understand meaning of the basic concepts. A drug or medicine is the chemical substance which can change biological function of the living organism and which use it for the prevention, diagnosis and treatment of diseases. Pharmacodynamic, that branch of pharmacology is studies how drugs affect on the living organism and relationship between the dosing and response. Pharmacokinetics is studies how living organisms affects on the drug. So absorption, metabolism, distribution, and elimination or extraction. Effects of drug, therapeutic effects of drug is beneficial effects which use it for the treatment of diseases. Toxic effect of drugs is harmful effects which appears when we use it incorrectly and overdosage. And using overdosage. Of course, must pay attention of the side effect of drugs which appears which unpleasant, sometimes mild of light effects. Let's determine the contraindication of drugs in processing which of drugs should not be used. One of the key basic concepts of the dosage drugs it is the physical forms which drugs is produced and convenient to apply for patient. I want you to inform mechanism of action of drugs. There are several branches, types. I will explain three of them. One of them, the reflex action of drugs, is effect which appears when stimulations of sensory endings or receptor at the site of drug application that outside the site of drug administration, another of drug administration. For example, mustard plaster, it reflects applied to the chest, reflects improvement blood circulation and respiration. Extract valeriana reflects action which has sedative effects through gastrointestinal receptor in before absorption. Reductive action action of drugs. It refers to the effect of drugs. They develop the after absorbed into the bloodstream to the organs or system. For example, antibiotics and analgesics. Local action drugs, it is effect which appears directly at the site of drug administration without absorption to the bloodstream living organism. For example, topical analgesics cream, solution antiseptics, eye drops, and nasal drops. Thank you.